With the new health crisis in full force all around the world, I think it is the right moment to take a look at healthcare systems and criticize the ones that don't work in those situations. Because seeing how a system reacts to a crisis, like an epidemic, is the best way to see its flaws, as they are magnified to a point where it's impossible to ignore those issues. For instance, there have been many issues with communication on the danger of the virus. Some still think it is harmless, even with contrary evidence, because this is what professionals said a few weeks before. The issue here is that we communicate information we're unsure of, thus leading to unsafe behavior and more people getting infected. In Italy, another issue showed itself when people sought out treatments or tests. Since there are no town doctors or any decentralized healthcare, everything went to hospitals. And they were not prepared to the sheer amount of people arriving in hospitals. Of course, this led to more people getting infected with the virus. Now, in Italy, there are too many people needing urgent care, making it so doctors have to sacrifice certain patients because some have better chances than others. Overflowing hospitals really show one issue, and it's on how unorganized we are in the face of a health crisis. Many people that could have not gotten sick did because of poor planning, and this led to even more people getting infected. This issue isn't an only Italy one. France is currently experiencing a lot of the same issues because of the late reaction of the government. Even if there are small town doctors, the hospitals will get overflowed, and some already are in certain regions. But the main topic today is America. The US healthcare is very different from the European one, and I thought that it would be a great idea to look at it now and see whether or not it is rightly equipped not only to fight against a huge health crisis, but also on how it works in day-to-day help in normal times. For those who don't know, the US healthcare system is a mainly private one. Companies take care of their employees' healthcare, and other companies are in charge of doctors and hospitals, which basically means this is a single-payer healthcare and not a tax-paid one. I'd also like to admit, for those who don't know, that I'm heavily leaning left in any political issues. And while I'll try to do my best to remain objective, the conclusion I will take will be bias. Note: bias doesn't mean wrong. It means that I take my conclusion because of my political views. One cannot take a conclusion while remaining unbiased, even if the conclusion is a correct one. If I say that, it's because I think there is a correct answer to the problems I'm going to point out. And often enough, truth isn't a democracy. So let's start with the arguments for a private healthcare. The first one being a public healthcare would be more expensive. This argument comes from the fact that people think that a privatized healthcare means that the government doesn't have to pay anything to keep it running, which is generally wrong, as it would save around 150 billion on paperwork alone. The thing is, the government still has to regulate healthcare in order for it not to poison the people that need it. Cutting the cost of the production of certain medicines and making them more unsafe as a result is something to avoid, so the government has to make sure everything goes well. And this is ignoring the fact that scams do still happen within this industry. Then there are the individual costs for everyone. And sure, people will have more taxes, but there will also be less overall expenses. Better pays could be demanded since the companies won't have to worry about healthcare anymore. Your insurance is going to be overall cheaper than what it is right now. Premiums, co-payment won't be there anymore. Plus, medicine will be provided by national healthcare insurance. So, while taxes will go up, people will overall pay less. The doctors won't see any changes in the pays normally. And even better, there will be a better job safety for them. So the system costs less for the government and for its people. But with our view of capitalism, does that mean it is worse? Well, no. The system will just not seek profit anymore. The quality could even grow as it is run by the government, so no cost cut would be done on important parts of the healthcare, like many companies do, like paying other companies to do things for them, or price gouging certain necessary medicine. A non-grid led system is one that is better overall for the people that need it. There will be, however, fewer small town doctors, as the government could decide to not replace the ones that leave. This leads to entire areas lacking doctors, which could be something that small companies could fix in a fair market. This is something that is happening in France right now, and has, however, some solutions that are not the privatization of those sectors. The French government today is very well led by the market, and so some decision resembles the one a company could have. So there, it depends on who is at the head of the government. Some also think that hospitals will be overrun by people seeking care, even when they don't need it, which is not a really good assumption when you look at how universal healthcare works in other countries in regular times. The system doesn't get overwhelmed, and the people that need it the most get cared for as soon as possible. And if the problem is people not getting care soon enough, the private system is even worse for the fact that some people will wait until it's too late because they cannot afford healthcare. In other words, universal healthcare is great if you want more people to be taken care of compared to the private system. The system has its flaws for sure, but they are all in a lesser extent than they are in a for-profit system. It's cheaper, better, and most importantly, saves more lives than a for-profit system. The last argument I hear a lot is the choice. In a for-profit system, you can have the choice to have insurance or not to have one. This means if you don't want to have to pay for healthcare, you can just not spend money there. This is not a good argument, for the simple reason of what they see as choice and what they don't. So to really address this freedom argument, we have to talk about what is a service and what is a right. A service is something that is often deemed private, something you pay for right on the spot or after it happened. A right is something that you don't have to pay for to a certain person. It's taken care of for you by the majority. You still kind of pay via taxes, but it is less expensive than if it were considered a service. Today in the US, healthcare isn't a right. This is why it is an expensive market. But if having rights like this is what bothers you, maybe we should look at the rest of the people that work to keep you safe. There's the police force, firefighters, soldiers, and many more institutions that work for the government. So, if choice is your issue, be consistent about it. You should refuse the police force and firefighters being working for the government. You should want the army to only be a private ordeal, and if you know what happens with those, you wouldn't. Come back to the virus, we'll use firefighters as an image. Imagine there's a fire in the middle of a city. If nothing is done, it'll spread fast, roar through the city, destroying countless lives and homes, killing countless people. Now, imagine that you have to pay for firefighters to save your house or building. This would be fine in the house of someone who can afford it, less so of someone who can't. And if this person cannot afford to take out the fire, it will spread and be uncontrollable. The issue here is that if someone needs care and cannot afford it, they will spread the virus to more people, and more people after that. And while the richer people could be fine with good care, the rest of the population will suffer. If the vaccine is private, many won't be able to afford it. They will make the choice to not pay for it, and this will lead to more people being infected by it. Thus, a health crisis will inevitably occur. So the issue with the choice argument is that it is only a choice for those who can afford it. Others will have to suffer without global help. I'd conclude by saying this. The universal healthcare system is better not only for regular times, but it also saves many people in times of crisis. And to make a bigger point about it, that's what leftist ideologies and socialism are about, caring for the many, not just a few. Thanks for watching.